Hi friends, today we will continue our conversation on the topic of cholesterol. It is cholesterol 5B, continuation obviously of 5A. And I will continue to talk about the topic of the numbers of cholesterol. And I said it previously, the numbers actually are not that important. But what is important is inflammation. How much inflammation you have, and not only here in the atherosclerotic plaque, but also everywhere in the body. And today I'm going to talk about how smoking and chewing tobacco creates inflammation, diabetes, insulin resistance, obesity, inflammation from the arthritis, lupus, psoriasis, other autoimmune condition, irritable bowel syndrome contributes to atherosclerosis. And I'll say a few words how to deal with that, and you will understand it actually. So let's go. So inflammation here in the atherosclerotic plaque and all over the body. You've seen already this slide where I said that I took it from the website of Mayo Clinic, and they define the cause of atherosclerosis. They say the causes exactly unknown, but it may that damage or injury to the inner layer of the artery happened, and that's what possible cause. And here on the right, you can see a possible causes. In previous video, I talked about how LDL, low density lipoproteins, when they get oxidized or damaged, when they go into the blood vessel, and then they cannot come out. They're supposed to go in and out and give fat as a source of energy. So today we are going to talk about smoking, diabetes, insulin, obesity, and other inflammatory conditions. So you may ask me a question: what is smoking and chewing tobacco has in common with diabetes or insulin? You probably understand diabetes and insulin resistance and obesity have a common denominator. It is insulin resistance. When the people or the person has a condition, instead of using sugar as a source of energy, they start to, because they're insulin resistant, then utilize fat as a source of energy. But smoking or psoriasis, well, let's go for the explanation. Now, difficult slide, I know, but I will try to make it really, really simple for you. Now, suppose person has a diabetes type 2, right? It's insulin resistant. They start to utilize instead of sugar as a source of energy. Every single cell is supposed to use sugar as a source of energy, but the secondary, if sugar is not available, and in diabetes type 2, sugar is not available for them, they start to use fat, because fat has a lot of hydrogen and oxygen, and when it gets oxidized, free radicals get created. They are free and they are radical. They run around and they create so-called oxidative stress. And by the way, using of fat create hyperlipidemia and create dyslipidemia. So they create oxidative stress inside the cell because oxidation takes place inside the cell. So result of oxidation stress and creates AGE. AGE is abbreviation that stands for advanced glycation end product. What that means that sugar that in the bloodstream that not utilized by the cells get combined with the protein or amino acids together. They stick together and it creates new chemical. And that chemical is endocrine active. It's attached to a receptor called protein kinase C receptor. It's a signaling pathway to the DNA of the cell. Once one is activated, it tells DNA and the cell in whole start to reproduce. That's how cancer get created. That's how autoimmune diseases started. And it depends which part of the body cell is located. So it elicits similar reaction, but the effect in different organs is different. So it creates so-called epigenetic changes. If that cell is a part of the lining of the blood vessel, epithelial cell, it starts to produce less nitric oxide, which is responsible for vasodilation and dropping in the blood pressure. No nitric oxide, high blood pressure. The next is activation of necrotic factors. My subscribers know about that. I talked about when the cancer starts to appear. It releases that necrotic factor into the environment, and that's what is actually the cancer cell is growing, and the patient becomes weaker, becomes chaotic, so they get smaller and smaller, and basically cancer consumes the patient. Angiotensin II is responsible for control of blood pressure, okay? And when it starts to produce more, blood pressure goes up, okay? And all of that happened in the blood vessel. Now, when the oxidation of LDL happened, and I talked about that in previous video, LDL get damaged. It goes here to give some fat and as a source of energy to the muscle cell or whatever is under the blood vessel. Because of the damage, they get stuck here under the epithelium, and they stay here. And immune cells that are right here, they come here, and it's a foreign body. It needs to be, eliminated, and they swallow that. Combination of damaged LDL and immune cells, they convert it into foam cells, and they are deposits, which basically is atherosclerotic plaque. And you can see that epithelium of the blood vessel actually is elevated, and here is your atherosclerotic plaque get formed. Independently, when this process of oxidative stress, AGE formation, and epigenetic changes simultaneously, let's say it at the same time, okay, it's going activation of immune system. As a result, immune system starts to produce monocytes and other cells that will actually start to deal with inflammation. So you see that independently, that's what is happening, and immune system start to attack those forearm cells, and there is more and more inflammation, and atherosclerotic plaques become bigger, bigger, and bigger, because it is an obstacle for red blood cells that circulate here in the blood. Erythrocytes hit here, they create more damage into the blood vessel. As a result, damage, thrombocytes come here, and the formation of that thromb is started, and the thromb, it correlates in clinical setting, is heart attack or stroke in the future. So that's how things work in diabetes type 2. When the chemicals or smoke from the tobacco, when the inflammation in the body, so it starts right here from oxidative stress. Chemicals, smoke from the smoke and the cigarettes or chewing tobacco. Chemicals from the food, such as herbicides, pesticides, coloring agents, sometimes drugs, they create a damage, they create oxidative stress, and basically everything is started again. And here, oxidative stress of LDL and immune system get activated. So that's the answer for you. What's in common between diabetes and chemical damage? This is oxidative stress. That's what is common. Now, you hear that the common denominator is oxidative stress. It's damage. So you need to decrease the damage. So what do? You stop smoking, okay? You treat the inflammatory bowel disease or rheumatoid arthritis or osteoarthritis. Address those problems before they started to create more stress and contribute to atherosclerosis, okay? And because there is oxidative stress, what do? You take antioxidants, right? And what are antioxidants? Vitamin C, vitamin E, mineral selenium. You also can take melatonin, start with 5 milligrams. Eat your fruits and vegetables. Eat your antioxidants, berries. Okay, guys, I hope it's clear. If you have any questions, ask me here. All relevant information in the description below. Please look at that and like, subscribe. Bye-bye for now.